Also, just while we're waiting for the last few folks to join, clearly you see on the screen there's a QR code for feedback afterwards. Please do post your feedback. Take the time. What things are you looking to see from Cisco in the coming months, weeks and months? What content, advice are you looking for? We'll happily take that feedback and look to provide any content and sessions that you're looking for. Okay, so just final shout out on the admin side. We're recording the call. This is our healthcare webinar series focused around networking and security. This is the second session. Just on the admin side of things, please don't post any questions in the chat. Please go ahead and post all your questions in the Q&A. That's the bottom right-hand corner of the WebEx client. You'll see in the breadcrumbs there's an option for Q&A. As I said, there'll be specialists taking and answering those questions in there. So yeah, welcome everybody. Last week we covered our view on healthcare. Both Declan and Hannah kind of looked at the main sort of careabouts, specifically in the NHS. Declan certainly sharing a lot of his experience and thoughts going forward. Hannah talking about DSPT, moving into the world of risk-based assessments in the CAF framework. This week we're going to have Joff and Ollie. Joff from our business unit, policy guru and ICE guru, and Ollie, our security specialist, mostly focused on policy and identity services engine, and really looking at how to get started on your segmentation and policy strategy, and some best practices. As you see on the screen there, we have our third session, same time next week, same day, and we'll be looking at how to, when the rubber hits the road, and how to automate this and do policy at scale in your infrastructure. So thank you for joining. Appreciate your time. We know that's valuable. Hopefully the content that we've got for you today very relevant in healthcare and policy and segmentation. And I'm going to go ahead and hand over to Joff and Ollie.
Morning, folks. Thank you, James, for that lovely introduction. So I'm Ollie. As was kindly introduced, I am a security specialist here at Cisco. So I am typically one of the faces that you will see when engaging in Cisco security conversations. I look after most of the public sector, everything pretty much but the secret squirrel customers. And what I'm going to do this morning before handing over to Joff is give you a little bit of just an introduction to kind of the common talking points around ICE and some of the sort of high-level groups, and then move over into a typical journey, just kind of set the scene a little bit. Now, obviously, the agenda for today, we're in the introduction phase. We'll be talking about ICE and endpoint visibility. Joff will be highlighting security policy challenges and the challenge of security policy. We'll be looking at simplified security policies. We'll be looking at segmentation phases, segmentation strategy. Very importantly, intent-based groups, because I know that's something that we have many conversations about. Centralized management and distributed enforcement. And finally, common policy. Common policy finally followed by ICE resources. But common policy is something that's a fairly new conversation and something that I know a lot of people like yourselves are kind of talking about now. So, to begin with, just to set the scene a little bit, something that we're not going to touch on too much today, but I wanted to highlight before we kick off is kind of the phrase zero trust. I'm sure you've all got your own ideas of what zero trust are. And most organizations, especially in public sector across the UK, are trying to deliver some form of zero trust in their environment. There are kind of Cisco has three flavors of zero trust. We have the workforce, the workload, and the workplace. The workforce being, I think, self-explanatory, protecting the people. Workload being sort of the applications and services you're running, and of course the workplace being the physical networks, the buildings, the sites, the tooling that you're kind of using day to day. Where we typically place ISE, although an argument could be made that it definitely stretches across all three, but primarily we tend to talk about it sitting within the workplace. There are three elements of ISE that are really critical in providing zero trust for your environment. There's naturally the visibility piece. ISE provides a really granular level of visibility to your infrastructure and your network and your users accessing the systems. When you have great visibility, you can then provide good segmentation, because ultimately it's all well and good knowing who's on your network and how they're connecting and what they're using, but you need to be able to segment, because ultimately that's where the real security policy and enforcement comes in. And when we're talking about zero trust, we're talking about shrinking those zones of access, shrinking those zones of trust, so that users and systems have the minimum amount of access required to actually deliver against the objectives that they need to achieve. And then finally, containment, because we've got visibility, we've got segmentation, but ultimately it's not a question of if something will go wrong, it's a question of when something goes wrong. We've all seen, I'm sure in the news recently, some major retailers have been having difficulty, and I'm sure they've been going through the expectation and the journey. How do we deploy containment activities now that we've seen this attack and we've been able to identify where it's attacking and how they're entering the network? Now let's deploy containment exercises to limit the damage, limit the lateral spread, and take action against them. And typically this forms part of the wider journey, not just within ISE, but it feeds into other technologies you may be using, like Cisco XDR for a shameless plug, or things like Microsoft Sentinel, etc. So before we go and hand over to Geoff, something I wanted to talk about, and we'll come back to this slide at the end as well, is highlight what sort of a typical customer journey is. So these are conversations I have very frequently with customers, because it's one thing to understand the capabilities of the tool, but what I wanted to do is front load sort of what that typical journey must look like, so that you can kind of compartmentalize and understand, okay, this would apply here and this would apply here. So you kind of visualize what that experience might look like for you. So at the beginning, there are kind of two areas we normally start, wired and wireless, but typically we recommend wireless as the first port of call. Deploying 802.1x to your wireless network. It's the most simple deployment. It's often the quickest, partly because it's, frankly, there's a little bit less config to do than on your wired networks. And what you can do is easily roll out 802.1x to a wireless environment for your guests, for your corporate, for your BYOD devices, or alternatively, just for subsets. So I know there are many customers who will start with guests, for example, then they'll add their corporate devices and then finally get onto their BYOD. Once you've kind of done that initial jump, we can then move on to wired deployments. And then you'll see in there that we've actually included at the bottom there 802.1x/MAB with profiling. Profiling is a very important tool within Cisco ISE. It's one of the reasons that we're able to provide such good control over who is connecting and how they're connecting. It's something Geoff will talk about during his session. But really, when we're talking about the huge amount of features that ISE is providing, profiling is typically the one that most customers will start with. When we look at Cisco's licensing structures and the way that features are broken down, I tend to recommend customers don't try and go for the big shiny tools right at the end of the licensing tree, because there's a whole host of features that you need to deploy first to really get maximum value. So when we've got through that initial phase and we've got through that initial journey of deploying wired and wireless and deploying profiling, we can then start looking at more advanced capability, like, for example, posturing. So profiling, to loosely cover, we'll look at things like, what is the device? Is it a Windows machine? Is it a Mac? Posture is when we take it to the next level and look at things such as, for example, what applications are running, hardware inventory, are the firewalls running, taking it to that next level to ensure not only is the device recognized, but are the systems and services running within compliance of what we're trying to achieve. And then finally, and I say finally as if this is what you do at the end. In reality, what you should be doing is applying segmentation kind of throughout the journey. But once you've deployed all three of these first boxes, you can deploy fully that segmentation experience to provide full segmentation across your environment. In reality, you might be doing simplified segmentation at the start, but by the time you get to that fourth block, you'll be able to do full security-based segmentation and do some really cool group-based policy enforcement to start using a lot of that information and data, what we often call context information within ICE, to produce some great policy control. And now, imagine you're in a situation where you've deployed all these great features that you're going to hear about. You can now do rapid threat containment. That is both capability within ICE, for example, between ICE and our firewalls, but we also have a very strong ecosystem with our partners where you can leverage a lot of third-party technology as well. I won't name any names for the sake of brevity today, but we work with a lot of medical partners, for example, in the healthcare space. There's very common use cases that we see, and ICE can help alleviate that rapid threat containment process with all of these existing technologies. Now, I believe, just if we can go to the next slide. Thank you, Ollie. The last thing I wanted to highlight before I hand over is kind of a list of the common talking points, the common technologies that kind of encompass ICE. ICE is a very long subject. We could sit here all day and go through all of these in great detail, but I'm sure you all love that, but we don't have time today. So what I wanted to highlight is really what each one of these elements means and give you an idea of what they involve. So device administration is simply TACACS, so I'm not going to spend too much time talking about that, but ICE can help you provide TACACS authentication to secure your infrastructure and your environment. Secure access, we're not talking about the new SaaS-based product secure access, we're talking quite literally secure access to your environment, providing that 802.1x, that radius connectivity. And that is the fundamental, that is the foundation of ICE, and without that we cannot do the rest of the great capability. Guest access. There are three sort of flavors of guest access. We talk about hotspot, which is something I'm sure we're all familiar with, going to coffee shops and whatnot, just quick access, hotspot from your phone, etc. Self-registered, these are typically something you see, for example, logging in with your Facebook account or signing up and providing a minimal level of detail. And then finally, sponsored guest. If you've ever been to a Cisco office or you've ever been to sort of corporate office, and this might be something you're using today, that's someone like myself or Joff creating an account that you can go and use to access the network. Guest is often an early port of call for a lot of our customers because they want to provide that level of visibility into what their guests are doing and ensure that there's that segmentation between what the guests are accessing and what the normal corporate users are accessing. Asset visibility, I'll come back to in a moment, and compliance and posture, I'll do the same. Context exchange, I mentioned earlier around third party in the ecosystem. ICE creates and generates and pulls together a lot of different information. We tend to pull all that data together and refer to it as a context. The who, the what, the how, the why, the when. What we can do with that information is both export that to other tooling and provide those insights into other security technologies to provide sort of that visibility. Alternatively, we can ingest data and help build out that picture of who's connected, how they're connecting, and allow ICE to make even better informed decisions around process and access control. There are further integrations with things like Cisco Catalyst Center. We can integrate with things like Microsoft Entra and another tool that I've completely blanked on in the moment, but a huge ecosystem, and those can feed into ICE. Catalyst Center in particular is very powerful because a lot of the policy and control elements of ICE can actually be managed from Catalyst Center. So instead of having to have multiple windows you're managing, you can do a lot of this from one tooling, which is very cool. Now, to summarize sort of the why customers buy ICE slide, we're going to talk about asset compliance, segmentation, because that will hand over nicely to Joff, who will then go through some of this in more detail. So asset visibility, we can kind of summarize that as the profiling. We're using probes, common ones being things like DHCP, radius, NetFlow, to identify what are the devices, how are they connecting, classify them so we can start grouping together resources, IP cameras, laptops, medical devices, nurse stations, shared stations, those sorts of groupings, so that what we're able to do is then apply policy based on those groups and not necessarily on an individual basis, and that really helps maintain operational efficiency. We then take that step further with the compliance and posture pieces. We support but agentless posture to provide that where agents such as secure client you may be familiar with aren't available. MDM and BMM can be added, and EMM, sorry, can be added to further enhance those data feeds and ingest those data points to make those as part of authentication decisions. And then finally, to summarize, we can take everything I've just brought together and start applying things like group-based policy. Because at the end of the day, you can have all the information, all the visibility in the world, but without good policy, it's mostly meaningless. So that is where isolate segmentation controls come in, particularly around security group tagging and security group ACLs, which are the more traditional you may be familiar with. So hopefully that sets the scene a little bit for you guys. Now I'm going to hand over to Joff, who will go through in more detail what some of the capabilities are and show you a few demos as well.
Yep, thanks very much, Ollie. Yeah, I'm Jonathan, or they call me Joff as a nickname. Yeah, I just want to thank you for joining. I mean, I was in hospital recently, and of course I wanted to feel safe when I was in there from cyber attacks and so on. And of course yourselves, you're here because you need to provide that business continuity. So thanks very much for joining. And as was said before, you know, you can't really protect what you can't see. So this is the first, my sort of entry into this webinar is the visibility of endpoints and users and things on your network. And of course, there are many, many more things these days than there ever used to be connected to the internet and to your network. So visibility is key. And I've got this slide here. We've got endpoints on the left. I mean, for yourselves, maybe think of a lot of medical devices that are connected to the network these days. And, you know, we want to provide zero trust, meaning don't trust anything. Let's make sure we authenticate and authorize things on the network so that we can, you know, gain that trust and not by default trust devices on the network. So we use Identity Services Engine, and you've heard the term ICE, I-S-E, as opposed to ICE. So Identity Services Engine, this is a Cisco platform that we use for network access. Now, when devices are connecting to the network and using Identity Services Engine, we've got a function, as Ollie said, called profiling, and this is detecting who and what things are that are connecting to the network. So what is it? What device is it? Is it an MRI machine? Is it an X-ray machine? You know, these sorts of things. So once we've detected, you know, what is connecting to the network, then we can think about, you know, how to segment the network. But the first point is about visibility. And the top right there, we've used all sorts of different probes and bits of information to detect what it is and what these devices are that are connecting to the network. And we also have a feed service. So you see in the middle there on the right, we have a feed service from Cisco. So, you know, when Cisco learns about new devices, particularly in the medical space, we can update the system so that we get more and more information. And obviously, when there are new devices being developed and added to the network, we can, you know, provide that visibility as to what these new devices are. And then in the bottom right, of course, you want this visibility. You want the UI to tell you information about these devices in terms of, you know, what are they exactly on the network. So visibility is key, and it can be provided by Identity Services Engine from Cisco. Now, we have been working with some vendors like Apple, Samsung, and Intel with those sort of chipsets providing a bit more information into the network. And particularly with our wireless, with our Catalyst 9800, this product can pick up these extra attributes and provide this to Identity Services Engine. This is just a slide to show that, you know, we've been proactive working with some vendors to give more and more information so that we can provide better visibility through Identity Services Engine. And also, we've recently come up with this term called multi-factor classification. Now, don't confuse this with multi-factor authentication, which we use these days, you know, using our phone as a second method of authenticating. Multi-factor classification is about classifying our devices on the network, i.e. what are they, but not just giving one result, i.e. not just saying it's an MRI machine. We're giving 4 results or 4 labels, and this is what we call multi-factor classification. And the 4 labels are the manufacturer, the device type, the model, and the operating system. And this just gives a better view of exactly what it is that's connecting, giving these four labels. So these multi-fact classifications just gives a better result at the end of the day. And once we know this, you may well want to segment based on a model of a device. Maybe different models, you want different security policy. Or from different manufacturers. You may have different MRI machines from different manufacturers with different security requirements. So if you've got that visibility, you can provide the appropriate segmentation. And then lastly, on visibility, you may buy, let's say, 10 more cardiology machines, and you connect them to the network. But let's say that they're brand new, they've just been manufactured, and Cisco don't really know about them just yet. Well, so they'll be unknown from an identity service point of view. But what the system can do is that we can receive attributes from these cardiology machines, and we can send them to the cloud. You can see on the right here, we've got the cloud icon. This is done in the cloud, but we just send attributes, it's anonymized, it's not necessarily, we don't know anything about them from a customer point of view. But our cloud system will cluster similar endpoints together. So it'll know that these 10 new cardiology machines are very similar because they're exhibiting the same attributes. So the system will cluster these together, and then we'll provide rules sent down to Identity Services Engine for us to classify these together. So it's done with a clustering mechanism. And once we've got these rules, you can use these in ICE. Either we will provide a suggestion as to what the device might be, or you yourselves can provide a suggestion. You know that these standing machines are cardiology monitoring machines, perhaps, so you can label them yourself, or we can give a suggestion. And so the system will learn from that. And then on, if you're adding more cardiology machines, then the system knows what they are. This is like a self-administering system, but we're clustering these together in the cloud. And this is how we're doing to help with unknown devices. And obviously we're using artificial intelligence for this and machine learning profiling. So this is really to help with unknown devices on the network. So these are all about visibility. And of course you can't protect what you can't see. So visibility is key in our segmentation journey. So let's talk a bit about segmentation and security policy. So what is the challenge? Why do we need to use what we call a group-based system? So let's think of a user, a doctor, nurse, whatever, at a desk. And of course, you're sending data across the network. So you're on a particular VLAN. And if you're on a VLAN, then you're using an IP address from a particular subnet. And if you're building a security policy based on these constructs, you're typically using IP access control lists to deny traffic from source to destination IP addresses. That's all well and good, but what if the user moves? Well, if the user moves to a desk maybe just down the same corridor, you may well be on the same VLAN, and you may be able to use the same IP address, and therefore your security policy doesn't have to change because you're using IP access control lists. But what if the user goes to a different floor? You may well be on a different VLAN. You'll have to change your IP address from a new subnet. And if your IP address changes, then your security policy will have to change because you're using IP access control lists. So IP access control lists are fine, except for in the mobility case, right? They're static and they don't move with you. The user may well go to a different building, different hospital, different trust, different VLAN, different IP address. Your security policy has to change because it's based on the IP address. Again, lots of us fly different places these days. Different VLAN, different IP address, and therefore different different security policy. It has to change. So what we say is your security policy is tied to the infrastructure components, typically the IP address. That's a major challenge for people and things moving around not just from one building to another, but perhaps from one room to another. So I know that a lot of the medical devices are mobile to move around the hospital these days. So how do we simplify our security policy? Well, this is an example of 3 doctors. Of course, there may well be many more, but it's showing an overlay on a map here. So this is to depict, it doesn't matter where these doctors are, okay? Now what we can do is group these doctors together. And if we group them together, let's give them a meaningful name. So the group might make sense to call the group doctors. Okay, so this is a group of doctors. And similarly, we may have some patient records on systems, whether they're in the cloud or a data center or what have you. But instead of dealing with these individually, let's deal with them as a group and give the group a meaningful name, like patient records. And now instead of dealing with these individually or dealing with their IP address, which could be static, let's have a security policy based on the groups. So from the doctors group to the patient records group permit the traffic. And it may be as simple as that. There may be 500 doctors, there may be 100 patient record systems. It doesn't matter how many there are in this group, your security policy is from doctors to patient records. That is why this is the simplification. Another example are health monitors. Again, it doesn't matter how many there are or where they are, as long as they can, connect to the network and we can assign them into a group. In this case, let's call this group health monitors because it's meaningful. And this is where we get intuitive networking from. It's intuitive because you can use the names that you like. Health monitors is very intuitive. Having a security policy based on a bunch of IP addresses and layer 4 ports is not intuitive at all. Customers tend to spend a lot of time adding security policies, but once they're added and they're forgotten about, they get added, and say the lists grow exponentially, and once they're added, people tend not to remove them anymore because you forget what they're used for, and it's not intuitive, it's not clear what they're being used for. So you've got these health monitors, and again, your security policy may be from health monitors to patient records. Perhaps you want to deny that traffic. Just in case the health monitors get compromised, let's stop all communication from the health monitors to the patient records, and then you're safe. And another example is, let's say the doctors need to gain access to the health monitors, but we only want to allow them secure protocols, so we're only going to allow HTTPS, for example, but block everything else. So you can do that level of control, choosing certain layer 4 protocols to allow and deny. So this is what we mean by simplifying our security policy using groups, and that's why we use the term group-based policy. Now you may hear this technology being called TrustSec, which is fine. Group-based policy, software-defined segmentation. In the Meraki world, it's called adaptive policy. A number of different terms, but it's the same thing. It's about using these groups to simplify your security policy. And look at this. Things are moving around. Doctors move, nurses move, and even health monitoring systems may move from one ward to another, or even one hospital to another. They move, they get a different IP address on different VLANs. They get a different IP address, but your security policy does not change. It's the same. So as long as we can detect these devices and things and people moving, put them into the correct group, your security policy does not change. This is the power of group-based policies. So segmentation phases then. We talked about visibility, who and what's on the network. That's really phase 1, if you like. Once you've got this visibility, we then go into segmentation. Now, you don't necessarily have to jump into group-based policies with, well, I'm going to talk about what that means in terms of tags and security group tags. The very first stage is macro segmentation. So this is something that's provided on your network and also provided by Cisco Catalyst Center. It's really segmenting your network from a routing point of view. If you can't route traffic from one entity to another, then that's great segmentation, right? And this can be provided with virtual routing and forwarding tables, VRF, So if you're familiar with that, then if you can't route traffic from one device to another, this is what we call macro segmentation, done with networking. It's very static, but very, very powerful if you've got entities which will never want to talk to each other. And this is called virtual networking in the Cisco Catalyst Center platform. So very powerful, yet static. So that's why we actually do need microsegmentation, because within microsegmentation, within the VRF tables, we still might want to segment further, and this is where we use our group-based policies. So lots of customers may use a number of macro segments as well as micro segments. A lot of customers may not worry about macro segmentation, may have just one routing table or one routing space, but use micro segmentation within it. And it's really down to your choice and the use cases. But micro segmentation is what we're going to talk about today, using group-based policies. And this is, as I said, having a security policy based on the groups instead of the individual entities. Now, I've written a segmentation strategy guide, which you can find online. You can just search using a browser. You can just search using Cisco Segmentation Strategy Guide, or there's a URL, which I've got in the top right-hand corner. And this goes through all sorts of aspects of our group-based policy technology, including software-defined access being controlled by Cisco Catalyst Center. And just to pick out a few points here on the left, many use cases can be localized. That's the second bullet. Now, I love this because you don't have to boil the ocean to start with, okay? If you haven't started on this journey, nothing is segmented in the network unless you tell it that you want it to be. So you can have a network access device, maybe in your office, maybe in the lab, maybe in a small space of the network. You configure what's needed, and only that device will be affected. You can configure enforcement on there, and you can test the technology. So on your floor, in your office, perhaps, just have one switch, and you can test the technology. You can configure your identity services engine for all the policy you need and test it locally on your switch. So many use cases can be localized. And I want to say that I know many trusts out there do have identity services engine. They use them for certain use cases. Ollie showed a list of all the use cases that can be provided by ICE. So you may have it for guest access or TAC or whatever, but because you've got it, why not use these other functions like segmentation and profiling for visibility? Because you may already have all the hardware you need to do this, but you just need to turn the function on these systems. So many use cases can be localized, don't overlook that. Adding dynamically assigned groups later should be easy. This is the fourth point. So when you've got just the one switch, you're testing it out, and you may be using 2 or 3 groups, it's very easy to add another group using Identity Services Engine. Maybe you want to add a group for a marketing department or research and development. It's very easy to add another group and add policy after the fact. Keeping groups as simple as possible is very key. You know, let's just add a few groups to start with, solve a few use cases, and then build on that as you go. It should not be necessary to transfer complexity. And I see some companies, they've got Active Directory, they've got 5,000 groups in Active Directory. That means they need 5,000 groups for security purposes, and that is not the case. You need to start small, and remember that we're assigning an STT or we're assigning these security groups based on a role in the network. So doctors, nurses, MRI machines, this sort of thing. It's about grouping things together with a similar security need. So don't transfer complexity from some systems into this technology. And consider if all roles need an STT, need to be put into a group, because we can deal with things not in a group. i.e., we can have a policy between known groups of things and also have policies using things that are not grouped, and that's what's known as an unknown group. So not everything has to be put into a group at all. So yeah, just bear these things in mind. Have a look at the segmentation strategy guide. I think that'd be helpful in your segmentation journey. And along with that design strategy, when you think about this, discuss and determine the assets that need protecting. I want to protect medical record data, what have you. Once you've got that information, you can then decide on the groups, how to classify things into groups. You've got a number of different methods. And then decide where your enforcement point might be. It may be on entrance to a data center, for example, or it may be on the access layer. And once you've got that, you can then go into further details about how to propagate this information, because an enforcement point needs to learn about these groups from the access layer. So this is a methodology of thinking about this technology. And you think, what do you put into groups? Well, we can put a number of things into groups. It might be certain users, contractors, health consultants. It might be your building management. So let's put thermometers, badge readers, heating and ventilation into a group. For medical, you might put life support machines into a group, or health monitoring systems, certain robots, surgical robots or what have you. Or it may be scanners, MRI machines, and so on, as into scanners, and more mundane things like perhaps printers or what have you. So this is sorts of things you can put into groups. Remember, there are things that you want a similar security policy for, but how do you put things into group? Well, typically we use Identity Services Engine, and when these entities and users are coming on the network, they're authenticated with ICE. We use AAA, Authentication, Authorization and Counting, which uses the protocol Radius. So we use Radius protocol to ICE. We determine who or what you are through authentication, and then part of authorization is, now we know who or what you are, we're going to assign you an SGT, a security group tag, and that goes down onto the access layer, such that traffic coming in from the users and things we can classify into this group so that we can enforce the segmentation policy. And this is what microsegmentation is. We've got authentication, we've got things coming on, whether it's a heart monitor and cardiology group, a consultant group, or a research and development group. We're authenticating, we're putting things into groups. And on the right, we've got this matrix to say a group-to-group enforcement. So from cardiology to cardiology here, if we look in that segment, it's a red deny. So your security policy may be you don't want anything in a cardiology group to communicate with each other. Whereas, from consultant to cardiology, it's a green tick, you may want to permit it. So this is your security policy based on a matrix, and it's this matrix which is key in Identity Services Engine and in Cisco Catalyst Center, actually, which is defining your policy. So that is authorization. What do you want to allow the user or thing to gain access to? And this is part of authorization and signing an SGT and having this security policy. So centralized management by Identity Services Engine, and we're distributing the enforcement. It's dynamic technology downloading to our platforms. So I've got a demonstration. You've got a demonstration. You see on the left there, we've got a device. We're going to put it into the cardiology group. Remember, it's intuitive. Cardiology means things to everyone. We know what it means. It's got an IP address, 10.65201. And then we've got the R&D machine. It's a robot. It's in the research and development group, and it has an IP of 10.65193. Now, this is key to know. The IP address is in the same subnet, it's in the same VLAN, but we can still use this technology even if these devices are on two adjacent switches, the same VLAN on the same switch. Doesn't matter, it's layer 2, layer 3, it's across switches are on the same switch. So the technology is the same. And we have this matrix to say we're going to permit or deny from between certain groups. So from cardiology to R&D, if you look at the matrix, down the left is the source and across the top is the destination. Cardiology to R&D is a deny. So let's have a look at the demonstration. This is Identity Services Engine. And have a look at the groups. We can look at the work center, and under components, we can see our security groups. And you see here, I've added a group called cardiology, and I've also got a group called R&D for research and development. So these are the groups we're going to use for our enforcement. Now, under the TrustSec policy, we've got a policy matrix. And you see here on the left from cardiology, and the destination across the top. So if I move the arrow to here, what we see here from cardiology, we're using a default policy to R&D. And the default policy here, it's all green, so it's just a permit at the moment. So this is my cardiology machine. It's using Windows because lots of our systems use Windows in this industry. So it's a very old machine, but we can just open a CMD window and try and contact the R&D machine. So let's ping the R&D machine. Remember, it's .193. I'm using a default policy on the network right now, so that ICMP is going through. So communication is working. But let's say we wanted a security policy to deny that. Remember, we had a deny in our security policy. So let's, in our matrix, go to that entry in our matrix again. But look, before we do that, let's go down on the switch and have a look at our security policy. At the moment, it just shows that the default is a permit IP, and we've seen that because we allow communications right now. Now, normally we wouldn't be going down on the switch. This is just for information to show you and how it's working. So in our matrix then, so from cardiology, and then across the top, we're going to go to R&D. Let's select this, and let's just set a very simple policy of deny IP, and let's save it. Now, to let the switch know of this, we're going to deploy this down to our network, and the policy is changing. So go to our cardiology machine, and traffic is now stopped. So it's as easy as that to change our policy, distribute it to our network devices, and this is implementing our security policy. In this case, we want to deny all traffic from our cardiology machines in the cardiology group to the machines in the R&D group. And you can see it's dynamic. We have downloaded this policy from cardiology to R&D, and it's a deny. And we can show that there are actually group-based policy counters on this switch. So we've got hardware denied is 6, and if we refresh this, it's gone up to 8. So that's a quick demo of how this group-based policy works. Now, we have many different domains in Cisco that we have to cater for. In the top left, we've got devices that are Meraki devices, our Cisco Meraki devices. Bottom left, we've got software-defined access. We've got security devices, firewalls. We've got devices outside an SD Access Fabric. Near the middle at the top, we've got our Cisco Secure Access, which is part of our Universal Zero Trust Network Access ZTNA story. Down the bottom, we've got software-defined WAN. The bottom right, we've got ACI in the data center. And of course, we've got cloud and external services. These are all different domains. So how do we deal with security policy across the domains? This is what common policy is all about, because a user or an admin in ACI may want to configure a security policy based on traffic coming in from the campus. But we want to be granular with what's coming in from the campus. What if it's like a doctor or a nurse or someone working in cardiology or traffic from an MRI machine? We want to be able to use them granularly. And the way we can do that is to share the group information between these domains. That's what this is about. It's sharing the context, not just the group information, but the IP memberships of those groups, so that we can have a consistent security policy across these domains. This is what common policy is all about. And this is a similar way of talking about it. We've got identity services engine in the middle. We can learn cloud workloads from any of the cloud providers and classify these services or these servers or virtual machines into groups, classify them into groups, making these security group, providing these security group tags, so providing this group concept. As I've already said, we've also got users and devices coming onto the network. We're authenticating and assigning them into groups. And this group information we can use on our wireless devices, our wires, our switches, our routers. Also send this context, this group information down to our firewalls. Not just our firewalls, but third-party firewalls, because customers have asked them to provide this group technology. And so they've done that. And provide it to Cisco ACI, even though that's a different domain. It's controlled by Cisco APIC. We can share this group information from campus to ACI data center and from the data center back to base to the campus so that we can share this to make consistent security policies. And we have our new concepts. Well, firstly, I want to talk about PX Grid. So this context is shared through PX Grid. Ollie talked about our ecosystem and sharing information with all sorts of different parties. So lots of different vendors as well as ourselves can gain insights and gain this context, this IP grouping information to provide security. Remember, security is about layers. Provide the security layers of an onion using our own services and also our partners. And of course, we have our newer systems through Security Cloud Control. We have multi-cloud defense. We have new systems, new solutions coming out soon as well. We have Cisco Secure Workload, which uses agents down on our servers. So this is all, a unified story of using these groups to everyone's benefit. So there's a common policy demo then here for the healthcare use case. Different domains in the middle. You might have Cisco Secure Access, you might have Cisco SD-WAN, you might have a security platform, Cisco Secure Firewall, but we have these other domains. So the bottom left, campus, might be hospital. You've got these different groups. We've already used the example of things in the cardiology group and in an R&D group. Top left, coffee shops, whatever, consultants working remotely, maybe on Meraki devices, so that's a different domain using the Meraki dashboard. Bottom right, data center, you may have medical records, EPR, and applications in an ACI data center, and you may have other services in the cloud, so that's the top right. So it's about this context in these different domains. So I'm going to show that we can classify R&D services or virtual machines and workloads from the cloud. We can classify them into groups, into Identity Services Engine. We can exchange groups with ACI, learn groups from ACI. I don't know if you know, we have EPG and ESGs in ACI. We can learn them into ICE and in the campus. And ICE can share these security group tags, these security groups with ACI as well. And you can build policy in each, which are consistent. And also, if ICE has this information, we can share that with Cisco Catalyst Center. So that may be where you're orchestrating your policy from. And another domain, we can share this with Meraki Dashboard as well. So sharing this context and this intelligence with all of these different domains. So a quick demo of that then. This is Identity Services Engine. And again, we'll go to our work centers and under TrustSec components and our security groups. So again, I'm going to show before, we've got all sorts of groups here, but we'll use the example of cardiology and R&D. So for our research and development, we've got nurses, NHS, and all sorts of things that are intuitive that you may want to use in different groups. But now, under this menu, we've got the integrations menu. So you can see under the workload connections that we've got, this is just my lab, but I've got a connection to ACI, it's a connection to the data center, and also I've got a connection to AWS, it's just one provider from the cloud, and we can learn these workloads and classify these into groups so that we can share with the other domains. So we have these connections, and once we learn these groups, we learn the IP address. So you can see at the top here, we've got a couple of IP addresses for R&D. And if you see on the right there, from cloud R&D services, these are learned from the cloud. So, we've got we learn IP addresses of workloads. We've put them into groups, classified them into groups. So these are the cloud ones. There's 4 more down at the bottom. We have a couple of groups here from ACI. So we've got the IP memberships. We've got the groups from ACI. And we've also got some groups here which we've assigned locally on ICE. So we have all this group information. It doesn't matter what domain it's from. We've got the intelligence so that we can share that. And so this is an example of in Cisco Catalyst Center. So in Catalyst Center, because we've shared this information from ICE, we'll go to the group-based policy and the security groups in Catalyst Center. And in here, we've got the group from ACI, the ACI client EBG and web EBG. We've got cardiology. In here, we've got scrolling down to R&D. So we're sharing this group information to Cisco Catalyst Center. And in here in the matrix, you can't see very well, but we've got the second and third down and second and third to the right. Groups from ACI. We can build policy based on this group information shared from ACI, or based on the group information classified from the cloud. So it's as easy as creating our policy like this, using this group information that is shared. Now, going on to APIC, this is APIC in the data center. Going down through networking and the interfaces coming into the data center fabric, you see here ICE cardiology, ICE R&D. These are groups learnt from the campus. And if we look at the SGT assignments, this is the IP address membership and cardiology. This is learned from the campus. So in APIC, you can build policy based on groups learned from the campus. And not only that, if we look at R&D and we look at the SGTs learned from the campus, we've learned the IP address that we assigned on ICE locally, but also the IP addresses of the workloads we learned from the cloud. So again, learned from the cloud into ICE, shared with the data center and the APIC fabric controller. So about sharing the context. Not only that, in here we've got our Meraki sync configuration. So in ICE, we can configure a connection to our org. This is an example of an org that I have in the lab. And I can share the policies, I can share the groups. And if I go across to my Meraki dashboard and look at adaptive policy, remember it's just the name that Meraki uses for group-based policy. And in here, we've got the ACI groups, learned from the data center. We've got cardiology, we've got R&D. So we've got the information from these other domains such that if we wanted to build policy in the Meraki dashboard, we can do it here based on the groups learned from the other domains. So this is just about security policy, but not just localized per domain. We can share it across domains, and this is what common policy is all about. So that's sort of, we've come to the end. That's hopefully been very useful. There's lots of ICE resources online. There are some examples here, particularly cs.co/ice-berg. You know, we spend a lot of time, but a lot of information in there. And also the ICE webinars. We provide at least one every month of webinars. You find them online under ICE webinars, but also in YouTube. So just wanted to say thanks very much for listening, and I hope it was useful.
Okay. Thank you, everybody, for your attentive listening, because I can feel your energy come through the WebEx app. We were hoping to have a little bit of time left for Q&A, but I think we're coming up to the end of the hour. So if you have any final questions that you wanted to chuck in the chat, now would be the time to do so. But of course, you can reach out to anybody, your Cisco account managers, your Cisco representatives, or us directly for any questions you may have. I wanted to finally close on this screen, this slide here, just to summarize. Hopefully by this point, now you've got an idea of a lot of the features, a lot of the capabilities, some of the tools that are available in ICE. You can kind of visualize how you may fit within this sort of customer journey. So every journey is unique, not every customer is going to do the same thing. But ultimately, this is kind of a summarization of the typical experience that we see. And with that, I just want to say thank you. And James, I'll hand back to you to sort of close the session.
Thank you. So big thanks to Ollie and Joff for such an excellent session, and thanks for bringing it to life with those great demos, Joff. Always really kind of nice to see a bit of context and feel for the technology. Thank you for your interaction. As Ollie said, some really good questions in the Q&A there. I've just posted that previous slide that Joff presented with all the resources. I've provided that in the chat window, so if you want to cut and paste that, those resources are there rather than waiting for the slides and the recordings. The recordings for session 1 and this session will be posted within the next couple of days. Thank you for being so attentive. as I said, same time, same day next week. We'll be talking about kind of in terms of deploying this configuration, automating the deployment of this configuration onto the network. As you've seen already, some automation of that policy. We're actually going to bring it to life in terms of getting everything from .1x and policy onto the infrastructure with Matt Graham. So again, really appreciate your time and attentiveness. Appreciate the questions. As Ollie said, please feel free to reach out to us directly. And again, thank you to our presenters today. Thank you. Have a great week and weekend. All the best.